I was born in Home, Louisiana, and I went there all through grade school and high school and went to LSU for college. I always knew I wanted to do something in science and medicine. I didn't know I was necessarily going to be a physician right away. But once I got to college, I decided to go into pre-med and went to medical school at LSU New Orleans. And then I decided to do ear, nose, and throat. So we looked at different areas of the country and we found Asheville, North Carolina. It was a beautiful place to live and they had a great medical community there, a lot of good physicians training from Duke and Wake Forest. And so we moved there and I practiced in North Carolina for 5 years. Had a great practice, private ENT group with 4 other guys. And I loved it. The only problem is all of our family was back here. We adopted our daughter and we missed our family so much that we decided to come back to Louisiana. I was the first ENT actually here, so that was a little bit of a challenge because I was the first one for the first 10 months. We started the department and now we're up to 5 doctors. So from in over 15 years we went from 1 ENT to 5 ENTs. I think ENT is a very unique field in medicine because we can see all ages. I've seen newborns and I have a 100-year-old patient, and there are not a lot of fields of medicine that you get to see all ages. And not only do we do surgery, so I'll do tonsils and tubes and sinus surgery, things like that, but I also do a lot of medicine within ENT. So we see patients who are dizzy, patients who are hoarse, patients with sinus problems. So a lot of surgeons, they spend most of their time doing surgery, whereas in ENT, we spend a lot of our time doing the medical side of ENT. So it makes it very interesting. It's a very unique field. When I came in '99, there were about 70 physicians, so now we're up to over 100 physicians. And I think what's so special about the clinic is the multi-specialty groups within the clinic and the fact that the patients can come see their primary care physician and then see a subspecialist. They can get their labs here. When I see a patient, I have a lot of their primary care physician's notes that I can get over the computer and all their labs, and the patients are so happy to be able to get all that in one place. And the quality of the medical care here is excellent, and I can always recommend any physician here with confidence that they're going to take good care of the patients.